Okay, so there's some COVID news coming out right now. I know we're all tired of COVID after, what is it, 2 years now? Oh, over 2 years of COVID messing up everyone's lives and plans, but hey, new variant just dropped. Hell yeah. And could this be the strongest COVID variant yet? Maybe. This seems more clickbaity. Let's go with MSNBC.
You may have seen different versions of
Vital
this
signs.
very colorful chart from the Centers
Very
for Disease
colorful.
Control.
Is it
given
this
that we
way? Dates for 2/4/9. Wait, is the 4th March? January, February, March, April. April 9th, April 16th. It starts, the red is BA
One of more and more
2.12.
new contagious coronavirus variants in the past year.
So it starts off with BA2 being the majority, and then BA1 shrinks down to nothing almost. And then BA 2.12.1 gets really big in April, May, but then BA4 and BA5 come on the scene and crowd out 2.12.1.
This is the CDC's variant proportion chart. It tells you how much of the coronavirus floating around our country is from one variant versus the other. And it
Yeah.
shows you how those proportions have changed over time, which is why you get that left to right color gradient. This chart, specifically the greenish teal bar on the chart, has sparked a bunch of headlines this week about the new subvariant of Omicron with the very clinical name BA5.
Actually, it's the worst virus variant. It's the ninja COVID variant. It's the most dangerous one yet. Is it ninja as in it's very stealthy, or ninja as in it will swiftly assassinate you without any warning?
Headlines are calling it, quote, the worst virus variant. BA5 is now the dominant strain in the country. It accounts for more than half of the country's COVID cases. We know it's more contagious than any previous strain we've come across
happening.
so far. And experts say there are some early signs that this variant might make you slightly sicker than previous strains.
Slightly sicker than even COVID Classic, than even Delta? Oh no.
We're waiting to get more data about that, but here's why it
BA4,
matters.
BA5.
Let's
Wait,
have
what
the
does it say?
strains.
The Omicron oh, it's Omicron subvariants. Okay, that's why they have this different names. Yeah, because I thought like the variants had their own letter of the Greek alphabet. Although I heard that they skipped a few Greek letters to get to Omicron, because one of the letters they skipped is the G, or the Z, which is spelled XI as in Xi Jinping. It would be really funny, actually, if there was a COVID variant named after the Chinese president, because a lot of people still think of COVID as the China virus, right? Yeah, I think that would be funny just to troll all those China haters, but no, we're stuck with Omicron. BA4, BA5 may be more virulent, causing more severe disease than the original Omicron. Uh-oh. Yeah, I heard Omicron spread all over the place because it's more like the common colds than other variants, previous variants, and so it spreads really fast but doesn't have a lot of symptoms, or not as severe symptoms. But since it spread to so many people, there's more viral load, or there's more virus out there, which means more chances for it to mutate and become a more serious strain, which it looks like is what happens. We'll have to see. Maybe we'll see where the variants originated. I mean, maybe they're tracking it. We'll see where it came from. I mean, there was a lot of it in the U.S. I mean, by the time the Omicron wave hit, America's like mostly given up at that point and actually trying to stop the spread.
We're waiting to get more data about that, but here's why it matters. Let's have a look at that chart again. What does it tell you? It tells you, yes, BA5 is the dominant strain. You can see that on the right side.
It's crowding out all the other.
It also tells you that this virus keeps on changing. It keeps
changing.
Every couple of months, it looks like there's a different dominant variant or subvariant. Every couple of months,
new COVID just dropped, and this one is looking like it's going to be a banger. It's the best one since COVID Classic, maybe, even.
The most prominent color on this graph changes. The vaccines and treatments we currently rely on to rein in this virus are based on old strains of coronavirus, and so far, that's worked out okay.
We need new
perhaps
treatments
until now.
Oh no, are we gonna get a new vaccine dose? That'll be a pain. I mean, maybe I'll get it. I got 2 boosters after the 2 original shots of Pfizer. I think I was supposed to get a 3rd or maybe 4th shot, but I didn't because, you know, too much work, and I thought I was protected enough already. But like, I might have to get another booster for this one if they come out with a new booster for it. I mean, we'll see. Cases are on the rise, and that's what we're going to talk about after this video.
Experts say this new strain of the virus, BA.5, is changing the playing field under our feet as we try to finally defeat this virus. The reason is something called immune escape.
Immune escape.
BA.5 is getting around the immunity built by recent COVID infections and vaccines better than previous.
Oh no! So like it's rendering all of the vaccines and the natural immunity obsolete. Oh great! We're gonna have to start all over and make another vaccine for this variant. Okay, great.
Already, daily case numbers are trending upward.
Oh shit! Look at this spike. Look at this giant spike for Omicron. Yeah. And look, right now we're chilling at about 100k cases a day, which is like would have caused a panic in previous any previous time. I mean, the 4th wave. This was the Delta wave. This was the big wave of COVID Classic during the first winter, with it spreading around during Thanksgiving and Christmas. Yeah, this is Christmas right here, the peak. Well, look at this. This tiny little bump is what caused all the panic that locked the country down for 3 months. At least a good portion of the country got locked down. But now it's like 100k cases. Yeah, whatever. Just another day in America.
The right side of the street. It doesn't look like much, but it's a bit of a trend. Because of BA.5. Anecdotally, it just feels like more and more people around us are testing positive. Hospitalizations in this country.
Yeah, it just feels like more people are testing positive. Yeah, I went to a party with a friend like 2 weeks ago because I was like, hey, COVID isn't that bad anymore. I mean, I know it's still out there, but like, I gotta get out there and like meet people, right? And I was like, yeah, sure, we'll do that. But then it turns out someone I talked to there got tested and they got positive COVID results. So yeah, it caused a big scare. Pretty sure I don't have COVID now though, and that was a while ago. So yeah, probably don't have COVID, but I'm gonna be more careful from now on.
Have also been trending up steadily since our most recent COVID spike in May and June. We know from our winter battle with the original Omicron variant that if this
Omicron's milder infections are straining U.S. hospitals. Is it because they're milder, but they're more numerous? COVID is less severe with Omicron than Delta. Yeah.
New cases.
If I'm not mistaken, Delta was worse than COVID Classic. I like calling it that. But Omicron non-dominant depleted U.S. hospitals now struggle to prepare for the worst. Oh no, now it's going to have to prepare for the worst again.
Quickly, there can be crippling spikes in hospitalizations, even if it's not a whole lot more virulent than previous strains.
Virulent.
So I have questions about what all this means for us and what we can and should do to...
Because like, even if there's a less of a chance that the infection is serious, there are more people being infected, so there's still more serious infections than there were with some previous waves.
Protect ourselves against this current version of the virus. And I know who just asked. Joining us now is Dr.
Wear masks, stay indoors, etc.
Medical contributor, critical. You'd think I know this, right? Then after introducing you, how many times have I introduced you?
By now, you know.
Critical care pulmonologist and a faculty member of the Institute for Health Metrics and Evaluation at the University of Washington. We have been speaking for over 2 years now. Dr. Gupta, thank you for being here. On one level, we do not
this
have
isn't Sanjay Gupta, is it?
We had in March and April and May of 2020. On the other hand,
oh yeah, those were the days.
We have this new strain, and we're a little confused as to what we're supposed to do about it.
A little confuzzled.
Ali, always great to see you. Good evening. It It's true, and the fact that really worries me is that 3 in 4 adult Americans that are eligible for their next booster
Vin
shot,
Gupta,
number 3,
in relation to
that
Sanjay,
next booster shot, have decided that they're not going to get it, or in some cases, if you're eligible for that 4th shot, they're not going to get it. That
the
is
4th shot,
in this era of a more transmissible variant, because Ali, come the winter time, if we're not up to date with our vaccines, those individuals who are higher risk are going to be the most likely to end up in the hospital, because while we focus so much on antibodies, blocking the virus from causing us to test positive, blocking
the virus
sore throat, the really key component here is something called T cells that harbor
T
pretty
cells
much in our lungs. They help prevent severe infection from occurring, but it turns out those T cells do require periodic boosts. People that need those boosts the most are not getting them. That's why we're really concerned about the winter and potentially surging again in the hospital.
Wait, who needs the boosters the most?
I know they've been throwing away dosages of
the old people, vulnerable.
Because they have a certain shelf life, and it's not just in the United States, Canada, and Germany. A lot of places are getting rid of vaccines. Do you feel what's supposed to happen? Is it just a matter of everybody being up to date on their vaccine regimen, or should we be discussing
make a new vaccine?
And what about this immune escape business? The idea that this new variant, the BA5, seems to be able to bob and weave its way around.
Bob and weave, just dodge and weave. Yeah, they juked. They're juking them.
Because you've had COVID or because you've been vaccinated properly.
Well, Ali, that last point, let's take that last point first. That is not unexpected. The setting of a contagious respiratory virus like, say, flu, for the last 40 years, all of us have been getting immunized against flu much longer than that. Flu evades, it causes immune escape all the time. We test positive for flu even if we've gotten the shot, but it's about 50% effective in keeping you out of the hospital. That's where we're headed. A vaccine, we're already there, a vaccine that is going to keep you away from somebody like me, but not prevent a positive test. This is entirely expected.
Wait, keep you away? What?
For like much longer than that. For years, all of us have been getting immunized against flu much longer than that. Flu evades, it causes immune escape all the time. We test positive for flu even if we've gotten the shot, but it's about 50% effective in keeping you out of the hospital. That's where we're headed. A vaccine, we're already there.
A vaccine that's not as effective.
Keep you away from somebody like me, but not prevent a positive test. We're already there. A vaccine that is going to keep you away from somebody like me, but not prevent a positive test. This is entirely expected.
Wait, keep you away from somebody like me.
Likely occur down the road. We shouldn't be surprised by it. To your point, is there going to be an up-to-date vaccine come fall for everybody wondering should they wait for that 5th booster shot that they haven't gotten their 3rd shot? Should they wait till fall for an up-to-date shot? I would recommend that you get that up-to-date shot if you haven't already. But once it becomes available in September, that's going to give you strong protection against infection for a period of time.
September, we gotta wait until then.
More broadly, Ali, we need to be thinking about a therapeutic strategy. I know the Biden administration is thinking about it. They're trying to institute test to treat, but we need to be clear-eyed about what a therapeutic strategy looks like come the winter and make it even easier than it is now.
In terms of prevention, a lot of people talk about the fact that, it's becoming just like the flu, but the distinction is you always know when you have the flu.
Deadly.
You are contagious once you have it. This continues to be something where people are contagious in many cases without having any idea that they're carrying the virus.
Yep, that's pretty scary.
That's right. And so asymptomatic
spreading the virus out without even knowing.
This is the reason why this has become a global pandemic. People are carriers, they don't know it, they're fully vaccinated, but they are still potentially contagious because they have vaccine breakthrough infection, but they don't have symptoms. Turns out in the setting of BA5, for all your viewers out there, just because I've gotten this question a lot, you can be contagious for a longer period of time. Conventional wisdom in the era of, say, the Delta variant was 5 days and then you're good. If you test positive on day 0, day 5, you're feeling okay, you can take off that mask potentially. In this case, you're contagious up to potentially as long as 8 days. So contagiousness is for a longer window of time. Important for people to recognize that if you tested positive, you're fully vaccinated, when can you take off that mask if you're otherwise feeling better? When that rapid test goes from positive to negative. There's enough to infect. There's enough to detect. I didn't make that up. Somebody else did.
So the rapid test works to test if you're contagious.
Understanding these complicated matters. Vin Gupta is an MSNBC medical contributor, a critical care pulmonologist, and a faculty member at the Institute for Health Metrics.
Any relation to Sanjay? That's what I want to know. It's got to be, right? There's no way there's 2 unrelated Guptas working for... Wait, I thought Sanjay worked for CNN, so maybe this, maybe they got 1 Gupta per news site. Okay, so, that's the news. So now I'm going to show you the numbers. So USA total 113 new cases yesterday on Friday. And that's only the cases that are being reported. Look at all these states that are not reporting any numbers right now. I mean, some of these states probably don't have as much as the big states that do report. California, Texas, Florida, New York. And of course, those are the biggest states. Highest population densities, higher populations in general. So yeah, they're gonna have the most, but like California is like the worst, is like, well, California is the biggest state, so maybe you gotta cut it some slack. Like 19,000 cases in a day. It's that's a lot. Yep. And Texas and Florida following close behind. At least New York is doing better than Texas and Florida. Yeah, back in the beginning of the pandemic, it was New York that was hit really badly, the Northeast and like the liberal centers of power, because like that's where all like the airports are, right? That's where all the methods of entry for the virus are. But then, of course, once it spread to the rest of the country, the red states and red areas were less able to deal with the spread, and so they got screwed really hard. I mean, if we can look, these are case numbers. If you look at total deaths, yep, the four big ones: California, then Texas, then Florida, then New York. For a very long time, New York had the highest death rate, had the highest death number. But then Florida overtook it, and then Texas way overtook it. Wow, look at this. 70,000 versus 89,000 dead for Texas. And then California, 92,000, but you can put that in perspective by looking at total cases per 1 million population of people. So Rhode Island is at the highest with 381 or 82K per 1 million. But Rhode Island is a very small state in the Northeast, so there's that. But Alaska is a very remote state with a very low population and low population density, but they got hit very hard. This is, you would think a place like Alaska or North Dakota would be the best equipped to, you know, quarantine different towns that have infections and preventing them from spreading to other towns that don't have infections, because the towns are like very relatively isolated with like just wastelands surrounding them, or like wild lands. Now look at this: Alaska, North Dakota, Kentucky, Tennessee, Utah, Florida, West Virginia, and then New York. West Virginia is just barely higher than New York. Yeah. So red states are the worst offenders here, and of course, yeah, blue states have high population densities, higher rates of commerce in and out of it, international travel, international ports of entry. So yeah. Where's California? Wow, California's all the way down here in 35th place in terms of total cases per population. So yeah, California just really is that big. Wait, hold on, what's the population of California? It's got to be in like 40 million at least, right? 50 million. So yeah, keep that in mind when you see all the high case numbers for California. Oh wait, Texas is all the way down here. That's interesting. Wait, that means they have a lot more people that can be infected in Texas. Oh no. Because it's cases per population unit. That means there's plenty more people in Texas that can be infected. So, fingers crossed. Yeah, it sounds bad. But Texas has a lower case per population. But I saw Florida all the way up here. But Florida has less deaths. I wonder, you would think Florida would have more deaths because there's a lot of old people living in Florida. Let's look at deaths per population. Mississippi, Arizona, Alabama. Of course, oh wow, of course the red states are going to have the worst death rate because they have the worst healthcare systems. Alabama, West Virginia, Tennessee, Arkansas, all very red states. And then New Jersey. Of course, New Jersey sucks on its own. We don't have to, it doesn't have to be run by Republicans for it to suck. New Mexico, very red state. Louisiana, very red. Michigan, yeah. Not very red, but Oklahoma, Georgia, Kentucky, all shithole states. And then New York. All the way down here, which was hit hardest at the beginning, the first 2 or 3 months. Oh yeah, Florida does have a higher death rate than Texas down here. Okay. But if we look at active cases, well, California, 757K active cases in Florida alone, and then California alone, and then Florida, way down here, less than half the population, active cases, that is. So yeah, even though California has low cases per population, like, it's the state with the most COVID inside of it, by far. So yeah, they should do something about that. We were just talking about how California has a budget in part because they saved up a bunch of money that was given to them by the federal government to help with COVID, and that might not be as productive as it might seem due to that surplus. But maybe they should have done some more stuff to prevent it. But you know, California is very all about freedom as well, right? So maybe they just don't want to do that. Where is, oh wow, New York is all the way down here at 66K. Below, well, all these states have lower populations. Because active cases is an absolute number, like total population is, rather than a relative number, like cases per population. So, New York, and then we have New Jersey up here. Oh no, New Jersey is right next to New York. Okay, we have to quarantine New Jersey. We should have already been quarantining New Jersey, to be honest, but like, especially now. Yeah, especially now. Wait, New Jersey is in the northeast. Are there any other northeast states up here? New York, Oregon, yeah, that's in the west. New York is up here because it has a high population. Wait, there are no other... Maryland is down here. That's a little bit below, and to the west of New York. So, I don't know what's going on in New Jersey. I guess New Jersey just sucks. That's the easiest solution. It's Occam's razor. New Jersey is bad. It's bad at everything, including stopping the spread of COVID. Yeah, all the degenerate, low IQ losers live in New Jersey and commute to New York. But we should quarantine them. We should just cut off all travel from New Jersey. People can leave and go into New Jersey if they want, but they can't come back. I think that's the rule we have to set. Okay, so what am I getting at here exactly? I guess just relaying this COVID information to you. Or we can look at which state should we look at? Let's look at California because it's no, please close. Oh man, this place has a bunch of ads. It's annoying. Okay, so as you can see, active cases did go down quite a bit, but going back up. Oh wow. At least it's not at 3 million. Oh gosh. And deaths are leveling out, but deaths trail cases by like a few weeks, because it takes a while for you to die from COVID. Goodbye Subway. Every eatery closing in 2023. Good riddance to Subway. Yeah, John Oliver did a whole segment on that. Yeah. Farewell. You will not be missed. So why don't we look at, how about Texas? Oh, this has it by county. Yeah, whatever. Oh, there's a lot of... Oh, and here we go. Yep, so active cases, yep, it's going back up. Should I screenshot this for posterity? Yeah, whatever. This graph looks like the same as like every other graph for America. How about New York? Kings County is Brooklyn. Queens. For some reason, Kings and Queens, that's funny to say, Brooklyn and Queens have the worst case numbers, but Manhattan is lower. I guess actually Brooklyn has a higher population than Manhattan, because Manhattan is where people go to like work and play rather than live. Of course, there are plenty of people living in Manhattan, but like most people, it's more affordable to live in Brooklyn and Queens and commute there. Of course, we don't talk about Staten Island. We don't talk about Staten Island. No, no, no. Okay. Ulster. Where's that? Okay. Cases in New York. I'll screenshot this for posterity. Boop. Active cases. Okay, we're doing okay in New York, actually. Look. We're still lower than we were. Where was this? What was this wave? I don't even know. There was a wave of, that other virus. I guess we can go back and look at that chart, but whatever. Hello, dog. My dog just forced me into my room. And deaths are still down. Look at this. Look how hard New York was hit at the beginning, but then we got it under control mostly until Delta, and then Omicron we had a few spikes, but mostly okay. Okay, well that's the state of COVID. Can we look at world? Oh wow, daily new cases, still down, but like still at levels that would have been peaks in 2020 and 21, and it's still rising, but deaths are down at least. Oh, deaths are way down, actually. Looks like we finally figured out how to take care of people who've had it. So yesterday, wow, 915,000. Let's look at this. Oh wow, France is not doing great. France is doing worse than America, in terms of total numbers even. And Italy, Germany, Brazil, Japan. Oh no, Japan. Japan is doing well, but then they sort of gave up. As Taiwan was doing well until they kind of, yeah. South Korea, Spain. Yep. Okay, well, interesting to know. What about 2 days ago? Oh my gosh. France, USA, Germany, Italy. Yep. COVID is spreading all around the world. And like a lot of other things, it's worse in America than most other places, but yeah. Okay, well, I think that's COVID, all the COVID news for today. Yep, just be careful. Don't go outside if you don't have to. Try to stay inside, wear masks, social distance, you know. You can still go outside and have some fun, but have responsible fun. Be safe about it, okay? Right? That's the whole thing. Okay. Yep. Be safe out there, guys. Goodbye.